Is it possible that the key to healing isn't just in what we treat, but in what we've never learned to release? Our guest today is an integrative MD with over 2 decades of experience in pain management and holistic health. He's exploring a powerful idea that many chronic illnesses may actually stem from unresolved blockages in the body, whether physical, emotional, or energetic. It's a concept he calls blockage-based care, and he believes it could mark a major shift in how we understand and treat disease. This is the story of neural therapy with Dr. Richard Nahas. Dr. Nahas, so nice to have you on.
Good day. It's great to be here. Thanks for
We
having
were
me.
chatting a little bit about a few topics just a second ago before we started, and it seems there's so much to go over, but I want to start very simple because I know a lot of people aren't in this world that we're in and listening to this. What's the simplest way to explain to somebody that's never heard of neural therapy and get them to understand it?
Well, it's such a simple concept that it's almost hard to believe that medicine forgot that our wounds heal, but not completely.
Yes.
And depending on how healthy you were at the time, how significant the injury was, how it affected you, how you interpreted it, what else was going on in your life, the the extent to which that scar can persist can sometimes be minor, but it can sometimes be very significant. And those scars that are left behind, both in terms of sensitive nerves and actual scar tissue in fascia, and it varies from person to person, but targeting those lesions makes sense. The idea that if there are 5 or 6 places where you've been injured before, when you see a doctor with any problem, one of the things that should happen is that we should treat those scars to help your body heal itself, in addition to whatever we do to treat your particular problem.
Right. And again, it makes sense on this kind of simplistic, which I think most of alternative or integrative makes sense when you explain it very easy. But then you have, of course, skepticism of where the double-blind placebos, where's the why isn't conventional medicine behind this? Why isn't this used more? Is the question. You, of course, started this concept of blockage-based care. How does that really differ from the conventional treatments you were seeing in pain management in the past?
Well, the natural tendency is to treat the part that hurts. And when you have knee pain, you may treat the knee with a steroid injection or prolotherapy or a PRP procedure or a surgical procedure. But if your knee is in pain because of an old ankle injury that distorts the alignment of the two bones in the lower leg, the fibula and the tibia, so that instead of being like this, they're just kind of kinked a little bit, that's enough to create imbalance in the forces that support the joint and cause knee pain. So treating the knee pain by targeting the scar in the ankle is a totally new concept. And the notion that that might be related to an appendix scar, uh, because the fascia above the pelvis pulls on the structures below the pelvis, is something that makes sense when you see it happening in a patient. You see things moving and pulling on each other. But for whatever reason, in modern medicine, now the approach is to do more for the knee. And there's no concept of the parts affecting each other. And that's really the holistic perspective that neural therapy brings.
And what about the unresolved kind of blockages that are there? Because we go beyond the physical here when we talk about energetic blockages, when we talk about emotional blockages. And these are blockages most people aren't cognizant of. They're not aware of these blockages causing the problems and probably the root cause of their illness or their suffering. Can you talk about how the blockages are identified, how they really do contribute so much to what we see as, illness in a physical form?
This is a fascinating subject because when you think of a scar in the leg, you assume that the leg is the place where the problem is. But the nerves in the leg travel to the spine, and from there they travel to the brain, and from there they travel back down. That's a circuit. And the way the nervous system is built is almost like a microchip with circuits, not just for one part, but for example, because we're four-legged creatures, and when babies learn to crawl, they're using a cross crawl pattern that mimics how most animals move. The notion that there are reflexes that connect the circuit from one hip to the opposite shoulder or from one wrist to the opposite ankle. It's not immediately evident, but when you think of it as a circuit that has to work together to help you move, it would make sense that a problem with that circuit affects the circuit as a whole. So when you have an emotional trauma, you have a heartbreak, you have a loss, you have a memory that creates negative thoughts or negative emotions when you think about it or when it's triggered. What that tells us is that there is a disturbed circuit. It's just not traveling to the body, it's in the brain itself. So while we can use palpation and physical assessment to identify scars that might be a problem in the body, there are other innovative techniques that you can use, like eye movements and tapping, to target scars that are more emotional or mental in nature.
Right. EMDR, EFT, all those techniques that really
Absolutely.
do go into those emotional sides of where things start up. And it's really fascinating because I was talking to a doctor friend the other day about the great increase in allergies in children's sensitivities. And part of what they were hypothesizing similar is that you take a benign substance and you're eating it in a stressful environment as a child. Let's say the parent is yelling, or suddenly it's some news thing comes on and it's stress. The body then sees that as stress. The immune reacts, overreacts to it. And then every time after, you have the memory, the trauma that's not released. And he was hypothesizing or saying basically that a large portion can come from that. When you take in certain substances, especially from starchy substances you normally eat, maybe some grains and things that are kids are normally sensitive to, even peanuts and other things, that if put in that environment of stress, the body sees it as that and then recollects that. And until you resolve that, it will continue to have the same overreaction or inflammation or anything else. If you look at scars and everything, and that forms a chronic issue. Is that something you'd agree with in the neural therapy sense of looking at this?
Absolutely. I think the this new paradigm that includes fried circuits
Yeah.
triggering the stress response in an abnormal way includes the concept that there are things that trigger them.
Yes.
So it may be a food, it may be a change in the weather, it may be a scent,
Hmm.
but when you're more irritable, it takes less to trigger that stress response.
How are you identifying them? Because I know there's different ways, and a person listening saying, well, I don't know where my blockage or interference field may be. How does one then locate that? Because I know there's a number of ways. How are you doing that?
Well, you can do this yourself. Um, in my practice, started out creating a table.
Mm,
How old were you? What happened? Which part of you was affected? And what was the nature of the sort of the complications? What made that event special? So Running through the list of any bones you've ever broken, any surgical procedures you've ever had, any lacerations, sprains or strains, any dental procedures that were invasive, root canals, wisdom teeth, that sort of thing, uh, any recurrent or chronic infections that you have had throughout your life, even in childhood,
Mhm.
ears, sinuses, tonsils, lungs, recurrent cellulitis, intestinal stuff. Those are all places where, we think of a patient who has recurrent bladder infections, and we just keep treating those infections without asking ourselves why the infections keep coming back. Did we fail to eradicate the organism? Well, no, you have a sensitive bladder because the nerves that supply the bladder never recovered from the first bladder infection. So, in terms of knowing what might be an interference field for you, it's helpful to start with a complete list. I'm putting together a service I'm calling the body map so that any
Mhm.
provider can get a PDF report that makes it easy to see where a patient has had interference fields. Some of my patients have had, 20 or 30 events that might scar them. And traditionally in neural therapy, there's been a lack of consensus about how many interference fields to treat in one visit, how to select which ones are more important.
Mm.
Some classically trained doctors from Europe will treat every interference field at every visit to make sure they don't miss any. Some will take a reverse chronological approach.
Mm.
So, starting with the most recent injuries and then working their way backwards, all the way to birth trauma.
Yeah, no, it's
Uh,
fascinating. And again, you get into the artistry of it, and each person's different. Some do kinesiology to try and see which ones are bioresonance or EAV testing, right? And there's so many
exactly.
different ways, but I think just the concept alone is game breaking because anyone that's ever had any scar tissue, you said it, I think one of the biggest ones is either dental, you get your wisdom teeth pulled, or in your mouth again, tonsillitis, you get your tonsils removed, right? You've probably seen this where you're doing those neural therapy injections, which are kind of trigger point like injections into that area to resolve those disturbance field, that interference field and blockage, correct?
Well, it's interesting because many patients will say, well, my tonsils are not a problem because I had them removed.
Right, right.
But when I tell them that the nerves are still there,
Yeah.
and that those nerves might be sensitive, affecting lymphatic drainage in the head and neck, potentially contributing to symptoms like brain fog or sensitivity to scents. The concept that most of how we interact with the world, our senses, are mostly above the neck, right? So we have lots of ganglia above the collarbones, and many of those chronic Lyme, chronic fatigue, fibromyalgia, mold, MCAS, chronic mercury toxicity. Many different monikers have been attached to those patients who are tough to figure out. And a lot of them just have interference fields.
Yeah, that is such an initiation point that's missed often, apparently, definitely by conventional side that don't even recognize these things. I was listening to once Dr. Bruce Lipton talk about tonsils, how important they are for the immune system, for catching things, and that how removing the tonsils is not a good idea if possible. And of course, conventional medicine says tonsillitis, you could just remove them. I was wondering your thoughts on tonsils, even going into the appendicitis and other things. What are your thoughts on when someone has an issue with them? Should they look to remove them? Is that the proper first step, or can we look to preserve that in any way?
Well, I think that there's an evidence-based approach that has kind of evolved over time. If you're from my vintage, you probably remember that there was a time when, you just had your tonsils removed because that's what was done. If you had more than one tonsil infection, they were gone. And it was just considered a preventative measure with very little downside. And while there's no clear evidence that having your tonsils removed can have an impact on your health later in life, uh, that question has never been asked.
Yeah.
And so I think what I do in my practice is on a case by case basis. And when I see people who've had recurrent tonsil problems, of course, I will target that with neural therapy if it's appropriate. But things like oil pulling
Mm,
are an excellent, that's an example of how you can drain the soft tissues of the oropharynx and the nasopharynx from any mucus, and you can engage the muscles that promote the lymph to move.
mm,
Uh, there are manual therapy approaches that may support release of mucus from the tonsils. Think about someone who has had 2 or 3 whiplash injuries and think of all of the tension in the head and neck preventing the tonsils from draining. It might be appropriate to consider a short course of acupuncture,
mhm.
6 to 12 sessions to see if that can support the lymphatic drainage of the head and neck as a whole. It's kind of silly to think of the tonsil as a discrete structure that's just sort of sitting there by itself. It's part of this whole network. Uh, and so, from my perspective, neural therapy has been a wonderful approach. And I think it's really important that more people learn to do neural therapy and more people have access to it. But my focus on blockage-based care comes from the notion that the really profound thing is not that neural therapy is treating these lesions, it's that medicine doesn't even know that they exist. And we're all walking around with these lesions that are treatable like germs. Before we knew that there were germs, people were treating pneumonia with, mustard plasters and things like that.
Mhm.
And this really just creates a whole new avenue for reducing the global burden of disease.
Yeah. And it goes beyond just scar tissue, right? When you talk about neural therapy, you look at segmental therapy, subcutaneous kind of injections to stimulate certain organs, the organs of elimination, and everything. Can you go into that a little bit for someone that's never really experienced it? Because most people, you think of an injection, you think of in the muscle, deep in, your vaccine kind of shot or whatever, and that's an injection there. But a lot of this is somewhat painless in a sense because people think needles are very painful, but I've received numerous bouts of different types of neural therapy throughout my body, depending on what was needed. And it's really painless in a sense. But talk about how neural therapy can even support organs where there weren't scar tissue or anything.
Well, this is closely linked to the acupuncture principle that nerves that come from the spine will often have a branch that travels to the organ, and the same nerve will have a branch that travels to a patch of skin over the organ. And so that's called a viscerosomatic or a somatovisceral reflex. So, one good example is detoxification.
Mm,
In my practice, I have done chelation therapy for many years. I see a number of patients who have consulted me about how to detox better. And there are many things you can do to support the kidneys and many things you can do to support the liver. But in my practice, often one thing that helps the process is some targeted injections, just very superficial, uh, nothing dangerous, almost subcutaneous, right? You can create skin blebs so you know
Hmm.
you're not hitting anything dangerous. Uh, and a few injections over the zone of the kidney, either on one side or the other or both,
Hmm.
can help the kidney function more normally, can take it may be that someone had a kidney infection in childhood, or they had a kidney stone and the kidney remained in a state of sympathetic dominance in fight or flight. The blood vessels are constricted. It's focused on protecting the organ rather than normal physiologic function.
Yeah, it's interesting because there's so much attention to detox right now, which is wonderful. We should be. I think you can agree there's a lot of toxins in there that get in our bodies that shouldn't be there and causing havoc in our bodies. And there is this, push for more detox and, your saunas and your IVs, IV pop-ups are everywhere and everything. But, the synergy of doing something like neural therapy along with glutathione or your just kind of different type of detoxes that are there just makes so much more sense, doesn't it? Because it's one thing to give the body an element that helps in detoxification. It's another thing to support the organs that are already doing it, right? We forget we have these wonderful organs of elimination that, if working properly, can usually handle the toxic burden. Now, of course, we're getting overwhelmed with toxins, but why not then naturally and easily support it with neural therapy? Wouldn't you say that's kind of the logical approach we should be going and utilizing more than just a singular path to try and just, boost our detox, pathways, but actually utilizing something like neural therapy to really get the detoxification going?
Absolutely. I agree wholeheartedly with that. And I would say one of the light bulb moments for me was uh, when I recognized that, specifically with patients who were coming in with heavy metal burden and were seeking chelation therapy. Uh, this is sort of the elephant in the room. It's kind of an inconvenient truth that there's no correlation between the total toxic burden and the severity of the symptoms. And what seems to me to be more the case, it's not just a question of toxicity, but it's a question of hypersensitivity to toxins. So these
Mm,
patients are more like allergic to the pollutants that their partners or their friends, they probably have the same amount of junk in their bodies, but they're not reacting in the same way.
right.
And so it's not just a neurotherapy approach. I'm sure uh, at your clinic, the concept of desensitizing,
Mm,
using vials or kinesiology to identify what people react to, and then using tapping or frequencies or remedies to turn that off. The idea that you can actually become less sensitive
yes.
uh, by desensitizing people to the things that they're reacting to, but also by treating the scars that make them hypersensitive in the first place. And so that's
Right.
where the interface between vibrational medicine and neural therapy comes in.
And that's the beautiful part because it is still a physical modality, of actually placing something and using physicality with a needle to inject a substance to trigger something, but it's also absolutely acknowledging we are energetic beings and vibrational beings. We react to those things. Our nervous system is a information highway that, if hijacked and you don't have cell-to-cell communication, you will not have proper and optimal health. Now, when I talk about the things that are injected into it, I mean, the Hunike brothers in the 1920s or so started off with, I believe, lidocaine, moved on to procaine, local anesthetics, right? And that's the most common. Is that what you're using in your neurotherapy injections?
Well, what I use varies from patient to
Okay.
patient. Uh, Neural therapy was developed in the 1920s. Uh, they're actually celebrating the 100th anniversary at a
Oh, yeah.
conference in Frankfurt this summer.
Nice.
And at the time, Procaine or Novocaine was the only local anesthetic that existed.
Mm.
And so classical neural therapy involves the use of what's called Implatal, which is a combination of procaine and caffeine.
Wow.
Uh, but procaine is considered the sort of the standard by purists.
Yeah.
That being said, there are doctors who are using other local anesthetics and reporting good results. And I'm a very evidence focused person wherever I can find it, whether it's, using the evidence I see in front of me or using the evidence that's been published. And I think there's a really good case to be made for all of us who are doing neural therapy to document what we're using and what we're injecting and crowdsourcing that data so that we can figure out whether one drug is better than another or one approach is better than another. Right now, what I use in my practice is based on what patients respond best to with energetic testing.
Mm.
And so some patients will get procaine, other patients will get lidocaine or bupivacaine or ropivacaine. And lower concentrations seem to work just as well, which is great because they're more gentle for patients, less risk of complications. And I'm also often using a little bit of dextrose
Mm.
to augment neural therapy. Uh, you've definitely talked about prolotherapy before, and this started with higher concentrations of dextrose, like 25%, sometimes up to 50%. And then about 15 years ago, a doctor from New Zealand named John Lithgott introduced PIT, perineural injection technique, using 5% dextrose, injecting into superficial nerves. So I sometimes will use a local anesthetic, sometimes I'll use dextrose, and sometimes I'll use both. And then there's a regenerative medicine approach. Some docs are using PRP and stem cells in joints to regenerate tissues. And there's another fraction of the blood, it's called PPP, platelet
Yep.
poor plasma, which seems to be more uh, helpful in healing inflamed nerves.
Hmm.
So, I think the neural therapy paradigm is not so much based on what you're injecting,
Yeah.
but on what lesion you're treating.
Right. And what person has that lesion as well, right? Trying to match it. It's a very individual, and again, it's an art form in many ways. And I know European doctors that use homeopathic remedies, even, trying to give the information to that area along with lidocaine. And again, that just adds another element to it of what you have to work with the person in front of you to do so. Now, for those listening and saying, okay, this sounds great. What can I expect afterwards? Is it kind of instant resolution and I feel, suddenly better? Or how many sessions will I need? Obviously individualized, but what are you seeing in the patterns of patients and in the improvement, what to expect?
It depends how long you've been sick,
Yeah.
and it depends how complicated your problem is. If you have a multi-system picture that's been going on for decades, uh, it's likely that you'll need a few sessions to see lasting, meaningful results. But there was something called the lightning reaction, which is sort of an immediate disappearance of a long-standing problem with a single injection or after a single treatment. And that's something we still see routinely. You may see a shoulder pain that disappears when you inject the gallbladder scar,
Hmm.
or you may see a neck pain that disappears when you inject a tooth. And that can sometimes be in one visit. But the thing that's interesting is that it's not so much like a cookie cutter approach where this treats this and that treats that.
Right.
you're looking at the regulatory system as a whole. And it's not just the nervous system. It's the what I call the pine system, the psycho, immuno, neuro, endocrine system. It's like one matrix that it's like the software, the operating system of the body.
Yeah.
And anything, any lesion anywhere can create any problem anywhere.
Right.
But the patterns that we see tend to be more following the pathways of meridians. And so that's a useful guide in my practice. I do a whole body approach, and it's rare for patients not to leave feeling great. The question is, how long does it last?
Hmm.
If the symptoms come back the next day, then typically there's something we missed and we need to dig deeper.
Right. And again, you're being an inquisitive artist in this all and sensing it. And sometimes when you peel back a layer of onion, another comes up. And so it's a continuous, and that's why I can't look at it as a one-to-one A plus B equals C. It is this kind of quantum reality of it that you could have so many things that will come through, but through resolving one at a time, you will get back to health or at least homeostasis. Now, you developed something called the Seeker's Method. I wanted to hear about how you came about that from going from neural therapy into the Seeker's Method and, more of this blockage-based care.
Well, in my practice, I inject patients all day. And I work in my practice in Canada. I spent 20 years working in the equivalent of a Medicare system.
Mhm.
And most of my patients were on very limited incomes. And so for that group, functional medicine testing, supplements, IV infusions, that's out of the question.
Right.
So I had to start learning to use more simple, basic tools. So I started using acupuncture needles, targeting the ear, and I started using my hands. I had been trained in auricular medicine. I had used EAV technology, and I had also learned applied kinesiology. And I don't think anyone ever connected those dots before, but it occurred to me that those three modalities are trying to elicit the same thing, right? So when a strong muscle goes weak, it's because you've triggered a stress response. When you feel a change in the pulse over a point on the ear, that's because you've triggered a stress response. And when something during an EAV test changes skin conductivity, that's because you've elicited a stress response. And it became evident to me that as I was working with my hands and becoming comfortable feeling tissue, that interference fields are actually palpable using light touch to identify areas that react
Mhm.
with a stress response. And that stress response is just an area that feels different. With practice, you come to recognize that there's like a relationship between the healer and the patient, and that when the patient has a stress response, you also have a stress response. And that's a beautiful part of the healing process. But when you recognize that these spots are palpable, then you start to see that you can connect one interference field to another interference field, and you can actually create a line. And you start to realize that the stress that creates the pain that pulls people out of alignment, that distorts anatomy in subtle ways that manifest as chronic disease, that these actually represent long chunks of flesh that are in a state of tension because of the 2 points connecting them. And you can learn to use movement and breath to create tension when they inhale, asking them to contract that myofascial chain, and then exhale and release. And I'm working to create more video content so that patients can learn to feel where they have interference fields, and they can learn to stretch and release as a self-care technique. So whether they're using yoga or Tai Chi, they can adapt that routine to do some stretching that targets a specific line that's stuck in them.
Mm.
And any rehabilitation provider can do the same with their hands. So neural therapy moves beyond being a single injection technique to being a neural therapy approach where, regardless of your modality, whether you're using your hands or acupuncture needles or laser or injections, targeting those lesions is a neural therapy approach that is what I call blockage-based care.
Yeah. And that's the thing. I mean, you could do it with needles, you can do it with light, you could even do it with frequencies. There's different ways, electrostimulation, all sorts. What we're talking about is this neural therapy approach with the injection of a substance to do that as well. But there's many ways about it, and I think the way you're going about it in a synergistic way of taking what was before and all these beautiful modalities and starting to put them together, you're getting this beautiful orchestra together, right? And that's what medicine should be. As much as there's specializations, and I think we're becoming niche specialized into further, things where you're just doing one singular little thing. Medicine, especially the whole concept of integrative medicine, is bringing together and seeing that. And in that, case, I have to ask you because there seems to be this, integrative alternative medicine side and conventional medicine side, and the two just, butt heads. And they say, you're wrong, you're wrong, do it this way, you're woo woo, whatever. Do you find in your concept, especially coming from a conventional background, that the two can work together and should? It's just how they need to go about it.
This is absolutely essential.
Yeah.
And I think what's missing is just a common language.
Yes.
So the notion that meridians exist is the first sticking point for conventional medicine.
Hmm.
And the key insight that opens that door and allows conventional and holistic practitioners to talk to each other is if we recognize that collagen, the stuff that fascia is made of, is piezoelectric. It's a crystalline polymer fiber. And what that means is that all of the electricity that's coursing through your nervous system is making collagen buzz. And that vibration is eminently palpable with our fingers. And the path of vibration flowing through myofascial chains is the flow of qi.
Mm.
It's the path of least resistance that vibrations travel through these fluid-filled channels. And that's why when European anatomists dissected the body a few hundred years ago and they couldn't find meridians, they assumed that Chinese medicine is bunk. Because you can't touch them and feel them the way you can feel arteries and veins and nerves. But if we have a common language that helps us explain energy in terms of vibration and electricity and palpable, real, concrete engineering stuff, then there's no disagreement. There's no basis for rejecting something. The thing that's challenging is that we are working in an era of evidence-based medicine where, of course, evidence should guide our decisions, but I think that many conventionally trained doctors don't properly use evidence-based medicine because in their mind, it's like a binary thing. Something is
Right.
proven and it's in the guidelines and I should do it, or it's not proven and I shouldn't do it. Whereas, the rational approach is to start with the things that are proven, the things that have the most efficacy, safety, cost, and convenience and patient preference going for them, and then move down the list until you get to the esoteric.
Right.
Again, focusing on things that are safer, less invasive, but doing what works. And I think if we can use the language of what I call rational prescribing, which means, you look at the options for solving a problem. You define what's the problem, what is it that I want to see improve, okay? What are the things that I could do to make that better? Let's talk about the options and decide what we're going to try together. And then let's try it. Let's set up a structured intervention trial. If it's a gluten-free diet for 3 months, or magnesium for 2 weeks, or this practitioner or that modality for 6 sessions. Let's see what works and keep using what works. And if something doesn't work, let's move on to the next thing. And so that structured, rational prescribing approach makes it easier for someone who's sick and lost and has tried everything to kind of chart a course for their healing and work with a provider over a year to say, we're going to try several things. This is not like a once and done solution. Uh, and I think with that approach, where you take a patient-centered, relationship-based approach, where the doctor's job is not to do what's in the guidelines. The doctor's job is to get the patient better. Uh, I
I
think
think
that's the
that
way forward.
I agree with you, and I think there is an over-reliance and hyper-focus on evidence-based and what that means. And I feel a lot of times just the tools and what we're looking at are a little different, right? If you're trying to find meridians in a panel, blood panel, you're not going to locate that there. But if you look into other devices that aren't as common in conventional medicine, but are quite science-based, you could start to rationalize that. And that's, a whole other field outside of medicine. Medicine seems to be reliant still on Newtonian principles that are very old in some ways and not on new principles that are actually validating so much of what we know and the ancient civilizations knew that are carried on, advanced in new technologies and discoveries themselves, like neural therapy, and therefore should be evidence-based but aren't. And then there's the other side of the coin, right? Like you're saying, what about experience-based medicine? What about what the actual patient sees, feels, and gets out of their experience in trying these things? And I think from that standpoint, you're going to find a lot of happy patients that have experienced better resolution than what the evidence showed them they should be doing. So that's where it starts to, open it up. And I do completely agree that if everyone came to the table with an openness, conventional surgeons, spiritual leaders, everyone that can help that patient and just place the emphasis on what can we do here together? Is there a way we could start on a drug but taper off, let the body get to some level of homeostasis, then go in with a natural, then go in with neural therapy, IVs, all this stuff, and address the root cause while still saying we acknowledge your symptoms and want to give you relief? I don't know. It just makes sense to me a little bit more than this way or no way, this way or no, and people suffering in the meantime. But there's also this idea, I know you wrote about this in the interesting pieces that I love to read about each guest, that you love to talk about intention and consciousness, especially as it relates to something like structure, water, homeopathy. And I'd love to get into that discussion because it is very important. I feel that if a patient, if a practitioner don't have a certain intention or level of consciousness, can healing even occur, or are we just managing disease?
Wow, that's a big question.
Yeah, I need to
Um,
open up the doors.
well, you touched on two separate but related things. So let me start with the first
Please.
one. Uh, I think that the use of evidence is uh, limited by the fact that the current medical paradigm is false. The current medical paradigm is that what we should be treating is a diagnosis.
Hmm.
And the concept that uh, everyone with pneumonia has a lung infection because a microbe invaded their lung is fairly straightforward. But to translate that to a condition like depression or migraine or irritable bowel syndrome is deeply flawed, because the fact is that if you take 100 people with the same diagnosis, they'll have that diagnosis for a wide range of different reasons. And if you treat the diagnosis rather than the reasons, you're treating shadows. So the neural therapy approach is not the whole solution, but it is a really nice way to personalize medicine, because every person gets a unique solution based on where they've been injured. Uh, Now, you touched on a couple of things uh, related to intention and consciousness. And I think the thing that I've been experiencing, and that's been a bigger part of my reality lately, is recognizing that my ability to heal my patients has evolved over time, not just because of the evolution of my techniques, but because of the evolution of myself.
Hmm.
Uh, and there's a moment where you're holding a tissue and your intention is for that tissue to release, and the tissue responds uh, because you have a clear mind and you understand that part of your job is to create that intention in the first place. And there's a lot of woo woo these days about the power of intention. But I mean, everything that we see in the world around us started as an idea. And I think the more you start to reflect on how important your thoughts and your intentions are, uh, the more powerful that becomes. And the more work you do on yourself, the less internal noise there is when you're doing whatever you're doing. And so your intention becomes less like an LED light and more like a laser.
Hmm.
Um, and so I think I'm a beginner on this journey that eventually culminates in uh, being the Buddha. That's the final destination for all of us, is to stay connected to our higher self,
Hmm.
that higher part of us that is not our monkey mind, but is our, for lack of a better word, our soul.
Hmm.
So I think I encourage any provider to embrace that path, but I also encourage patients to embrace that path, because, this idea of learning to feel where you have tension on your skin, it's part of a journey that continues down a road that goes into recognizing when you're emotionally triggered
Yeah.
and recognizing when you're having a thought that doesn't serve you, and recognizing when you're engaging in habitual behaviors. and recognizing where they come from. And, the more you understand who you are and why you are who you are, then the easier it is to walk down that path that leads to self-mastery.
Yes. They say it takes two to make a thing go right, right? That song from back in the day. And it's true. It takes two in healing, right? The doctor has to have that intention and a consciousness level that's going to allow the healing to flow through, but also empower the person. But the person themselves, the patient needs to have an intention of helping themselves. And oftentimes you see this where a patient says they want help, they want to get better, but deep down, there may be a underlying belief that they're not worthy of health. That maybe something they did, in the past or something means they need to suffer, or it's karmic. Some people say that they need to go through this and everything. If someone's finding that they're in this pattern of constantly being, no matter who, they go to you, they go to everyone, they go to our center, and still nothing's working, you have to start to look inside. But how does one start to change that? Because I know it's so difficult when it's not in your mind. You're saying, I want to get better, but there is some subconscious belief probably there that's keeping you from going past a certain level. Have you ever explored the idea of trying to clear those types of thoughts that we don't even know we have?
Yeah, again, there are many levels to that.
Yeah.
Sometimes that can be addressed through uh, a meaningful conversation. Sometimes you need to induce an altered state of consciousness, whether
Mhm.
it's hypnosis or uh, psychedelics.
Mhm.
Sometimes it may be something that is deeper and ingrained in the family system. And I've had some experience with family constellation therapy.
Yes, Hellinger's work. Yeah, Bert Hellinger. Yeah.
Just fascinating, right? You'll
Right. Very.
you'll be in the audience and you'll see two people enacting a scenario in silence.
Hmm.
And this, I think, is something that's really beautiful because the mechanism of healing is catharsis. This idea that when you go to the theater, you are healed by watching the performance. It's very cathartic to go through family constellation therapy.
Hmm. Agreed.
Sometimes it's possible to use muscle testing to identify a specific thought or a specific belief that triggers a stress response and makes a strong muscle go weak. And you can use tapping or eye movements to turn that off. So I think you have to be an artist
Hmm.
to be a healer because, of course, there are formulas and guidelines and regimens and rules of thumb, but um, every it's not just that every patient is unique, but every scar is
Hmm.
unique and it occurs at a different level and it has different factors affecting how it needs to be resolved.
Yeah.
You look at dental issues, sometimes there's mushy infected bone that needs to be scooped out of a
Right.
rotten dental socket. But sometimes the issue is that someone's spouse died 3 days before their procedure, and there's a completely different set of tools you need to use to get at it.
Yeah. No, it truly is. This is, my father always said, medicine is an art form. As much as we want to make it a technicality where you just read a number and say you need to do, oh, this the book says. That's not true healing. Now that's disease and management in a sense, and you could do that too, but there's also such a reward to the art and to being an artist and truly always trying to progress your craft as a doctor, as a healer. So I think that's a big one. Is that something you're teaching? I know you're doing workshops now. I know you're working with practitioners to help them out. Is that something you're also kind of bestowing upon them to be more of an artist and not just know the technicality of where to make a neural therapy injection if need be?
Well, I think touch.
Mm,
is the thing that I teach that's the most important piece of that in terms of becoming the artist. Um, so when I talk about the blockage hypothesis, right, I use the term hypothesis because it's not proven yet. When it's proven, it'll be the blockage theory, like the germ theory.
hmm
So there's four principles to this. One is that these lesions exist, that our scars don't heal completely. Two is that those are palpable.
mm,
Three is that by connecting the dots, we reveal a whole new level of structure in the human body that medicine doesn't know about, what I call the new anatomy. And four, which is the point of all of this, is that treating these lesions stimulates the body to heal itself.
hmm
And so, you have to be a different kind of artist for different parts of the procedure. You have to be an effective communicator and you have to engage patients to get all of the information you need to know what happened to them and why. And of course, you have to be skilled and you have to use some manual artistry to be able to inject people with gentleness and keep them calm and hold the space and make the experience a healing experience.
Yeah.
But when you start using touch to work rather than using thinking to work, uh, you enter the headspace of the artist, right? Like when someone is dancing, they're not thinking about how to dance, they're in flow. And when you watch Miles Davis playing the trumpet, you know he's not thinking about what to do next. It's coming from somewhere else.
hmm
And when you start using touch, you're always engaged with the patient. You're paying attention to what's happening moment to moment. You're living in that flow. And the more time you spend in that flow, the more you evolve. Does that
And
make sense?
that makes total sense. And I truly believe as we move into this realm of AI, just pure telehealth and everything, that now more than ever, we need doctors that still embody that touch, that ability to connect and build trust and relationships with patients. And so I know, so much of what a patient wants is kind of the comfort of sitting at home and being able to, get some sort of treatment without leaving their bed. But the truth of the matter is that it requires some sacrifice to heal, I think. And it requires a true in-person exchange of energy almost to get that. And that's what you're talking about. And that touch alone is healing in many ways to a patient, and it shows care, and it shows a true humanity restored back to this art form of medicine that's become a technical aspect where we want AI to consider just what it's going to prescribe to you, it seems like. So I feel like, as people move one way, you have to look back the other, and look at that element of touch, of being there, procedures in person, building that, speaking to them and looking in their eyes and touching and seeing the reactions. That's a big part of medicine. I'm really happy that, that's something you're working in there into the workshops. And, the palpitation one was interesting because that's a development, right? You've created that isn't a set, standard in, let's say, teaching neural therapy. Where'd you come up with that as an addition, and what have you seen with that palpitation part?
Well, the palpation guided approach that I teach is something that I think is a new physical examination technique that should become a part of medicine. Uh, and, in the same way that a medical student doesn't learn to hear a heart murmur the first time they put on a stethoscope, you're not necessarily going to become very skilled at this the first time you try it. But I've come to see that most people can become comfortable with this after a 2-day workshop.
Mm.
Uh, and I developed this first by assessing scars. Because when you look at a scar, especially a long scar, you'll often see that there's a part of the scar that looks different from the rest. And, in neurotherapy, we learn to treat the whole scar. But what I came to recognize is that some parts of the scar also elicit a different feeling in my finger when I touch them. Not that they feel different to touch, they're not harder, they're not more tight. What
Mhm.
happens is that there's a little zing that you feel when you use light touch to slide over that point.
Mm.
And that's a point that's sensitive. That's a point that's reacting to light touch when other areas of skin do not. So finding the spots that react to light touch is what I call eliciting a cutaneous stress response using light touch.
Mhm.
And what I'll often find, for example, is if I'm looking at a painful ankle, in some cases, that area is in the plantar fascia. In some cases, it's in the muscles between the toes, the interosseous muscles. In some cases, it's over an area where an ankle sprain left the ligaments traumatized. In some cases, it's the Achilles tendon. And being able to have patients pay attention to what you're doing and asking them to notice, do you feel that that area doesn't feel the same? They'll say, yeah, you're right on. That's
Mm.
exactly the point. So it's really nice because patients feel that you can feel what they feel. It gives them confidence in what you're doing. And when you inject that point in a very precise manner, targeting just that spot, and you resolve their symptoms, uh, it's a confirmation for them and for
Right.
you.
Right. And
So that's how that came about, starting with scars and then continuing to any patch of skin, whether it's over an old fracture, an old infection. If someone has had tonsil problems, you can usually tell which tonsil is the problem.
Mhm. And the beautiful part of that is that it's both teaching the doctor, the practitioner, and the patient. The patient has a reaffirmation. Yes, that is the spot. Yes, I know my body. Yes, right? It's
That's
almost
right.
like building the intuition that we have that we've sort of lost over time. And so
That's right.
both sides win. It's not just a doctor telling you, you go, okay, I didn't feel anything. I don't know. Let's go with it. It's getting both of you involved. So that's really wonderful. Where are the workshops and how can doctors listening get involved?
Well, I have my website uh, in progress. I'm going through a career transition right now. Just opened my office in Manhattan um, to not primarily to treat patients, but primarily to be a base to create a movement.
Mm,
And so my website now is
mm,
richardnahasmd.com. And I have some workshop dates coming. The next workshop will be in July in DC. We haven't selected the venue yet, but looking forward to that. And I think my group, the North American Academy for Neurotherapy, is also an important resource for anyone interested in neurotherapy. So naant.org. Uh, I have several colleagues who are doing great workshops on the West Coast. So Jeff Harris is a naturopathic doctor who's been teaching for decades. Ann Hill and Ilana Gurovich are teaching workshops. One is in Portland, the other is in Seattle.
mhm.
So not much neurotherapy training on the East Coast. So I'm hoping to bring that with some colleagues on this side of the country. And just generally speaking, there are very few educational opportunities for providers who want to learn about neural therapy, and that's the rate limiting step we want to address. There's a great program in Heidelberg, Germany every summer. Most of it's in German, but they have an English day. There are Spanish language programs in Colombia and in Spain. And unfortunately, language is the barrier, right? That's one of the reasons that there are 30,000 doctors worldwide who do neural therapy, medical doctors, all of them.
Hmm.
And here in North America, we have a very small number of docs, and unfortunately, only a minority of us are MDs and DOs. Not that naturopathic doctors can't do excellent work and don't do excellent work. And, some of our members are nurse practitioners and acupuncturists who have a license to inject depending on their state. But I would love to see more doctors treating patients with neural therapy.
Absolutely. I agree. It's such a powerful and again, somewhat simple. You don't need large hookups and machineries and, all sorts of things that are truly invasive. So it really is such a powerful therapy that I feel like anyone can incorporate as a doctor with such ease and simplicity and see their results just increase and improve. And so I do hope more and
Absolutely.
more doctors get on board, kind of lose the stigma of it being something outside of, just the conventional realm and start to appreciate that this is a very powerful therapy they can incorporate. And for any patient or anybody listening right now thinking about whether or not this could help, I think it absolutely can. And at least to explore, bring it into your awareness field and see if it's right for you and connect with doctors such as yourself. So really quickly, before I let you go, structured water. That's something I've harbored on for a while because everyone's asking what's the cleanest water? What about filter? Everyone has an app now, and patients send me all the time, oh, this one said it's high in lead, and this one, and but is it really more so? You want clean water, but also I know that you kind of you have your own structure, I believe, and you can get into, but is it more so about the structuring than it is even about what's in it? What are your thoughts?
Uh, Structured water, unfortunately, still is in the category of pseudoscience.
Yep.
But several years ago, I discovered this by accident. Uh, I'm Middle Eastern by background, and we have a tradition of drinking water from a carafe with a little spout that we pour into our mouths and we drink and swallow as we drink. It's very satisfying. So one day I filled a glass carafe of water and I put it on a cluster of quartz that I had in my home as a decorative piece. And I left it there overnight. And the next morning, when I went to taste it, it was completely different.
Mhm.
And I had my wife taste it and she could taste it. And over the next few months, I had guests who came to my house, family and friends, and I'd have them drink a glass of water, take a few sips, notice the taste, and then I'd add about an ounce of this crystal water, I called it.
Mhm.
And about two-thirds of them said right away, whoa, that's changed. So that led me down a rabbit hole that uh, has included launching a bottled water brand called Vicus. Over time, we became members of an institute in the Netherlands called WETSUS. And this is a center for excellence in water research. And it's the only place in the world where there's research going on to study the physical properties of water. It's called the Applied Water Physics Research Group. And the exact mechanisms are being worked out in terms of nanobubbles maybe affecting the structure of water or its physical properties. A lot of the research that they've done has been around using a vortex to structure water. And many people can structure their water at home by passing it through a rifled pipe that
Mhm.
creates a vortex. And I think the thing that for me is most profound is thinking that the water in nature is structured for a reason.
Yes.
And that reason is that the earth is a giant magnet.
Hmm.
And just like there's piezoelectric collagen in the human body that turns electricity into vibration in us, the crust of the earth is filled with quartz
Yeah.
that is making water buzz on our planet. And so all of the water that we drink is what you might call living water for that
Mhm.
reason. And when we process water to make it safe to drink, whether we use chlorine or ozone, it may be that we're breaking apart this lattice of H2O molecules that exists in water, these geometric shapes that mimic the shapes of quartz and collagen in nature. The same way that homeopathy works, where you dilute a substance until there's nothing of the original substance left, but what's left is the structure of those molecules stored in little pieces of Lego called H2O.
Right.
And so many people are using crystals in their water bottles,
Hmm.
or, there are magnets and lasers and other things that you can do to structure water. And, what's a doctor doing making water? I think for me, this is intimately connected to this concept of chi.
Mm.
I think that water is the essence of life for us in our bodies. What makes life possible is water and its unique properties. And I think the same is true for why there's life on Earth. I think
Right.
without water and without structured water transmitting information between a cell and its environment, between a human and its environment, life is not possible. So I think this is really, it's fascinating, and it can be a rabbit hole, but I think the message is that water has properties that are unique and important. And if you want to be healthy, yes, you want to make sure that your water doesn't contain microplastics or lead. Yes, you want to make sure that it contains the right minerality. But I think it would be my ambition to see that one day we all know that if you're not drinking water that's been restructured, you're missing something.
I couldn't agree more. And it is really a fascinating subject. And we could have a whole episode probably just about us between the two of us. But you're right. I think there's something to be said when we are 99% molecularly water. What is the quality of the water? Not just looking at less impurities, but actual structure to it. And Emoto's work is fascinating also, right? In the structure of water, how you speak to water and it changes the crystalline structures when you freeze it and all these things. So it's really
Again,
fascinating.
I love this guy's story and I love his work. And it's unfortunate that he's been categorized as a non-scientist and that his
Right.
work is pseudoscience. But I think it's important for science to try to replicate his findings. I think I was astonished to learn how little science is done on the subject, right? There's
Yeah.
lots of research that shows that hydration promotes health, but the issue of water quality and health and these deep questions around, this most basic substance on earth. Why are we studying uh, erectile dysfunction, but we're
Yes.
not studying water?
Right. The basis of everything, it seems like it's the study of cells almost. It's the same equivalency that we need to know the building blocks of who we are to understand how we could stay healthy. And water's just so essential, as is sunlight, as a most of nature, right? Nature shows us the answers here. Well, Dr. Nahas, I really enjoyed this conversation. There were so many topics that we hit on, and I think the audience would love it too. Thank you again for coming on. This has been a pleasure. I hope we could have you back.
It was my pleasure. Thanks for having me.
And be sure to visit Dr. Nahas' website at Richard Nahas MD. That is NAHASMD. He's also on a bunch of social media channels: Instagram, Facebook, TikTok, YouTube. We'll include all of those links in the show notes. And until next time, keep writing your own healing story.